All right, we're here to start the delivery process, how we prep for the delivery and for the collection of cord blood. The kit will come with the mother and handed to the medical professional. Kit is all barcoded and labeled, so you don't really have to worry about labeling anything. We'll open the kit. Inside, there are three things. One is the delivery record, which can be filled out by the delivery nurse or the physician. Two are two bags, one that says baby supplies and mother supplies. The first one to take out is the mother supply bag, which contains two purple top tubes that are pre-labeled, and all you have to do is take blood from the mother. That can be done really before or after delivery, but it's nice to get it out of the way. Place the tubes back in the bag if possible. Second kit is the delivery kit. And then the third thing is the delivery or the blood containing bag. Can then get rid of the box and move it to the side. As we bring the baby in, we'll use the mock of the umbilical cord, the placenta, and the baby. Right before delivery, you'll have this bag out. There is a label provided that will go on the delivery bag. The reason it's not already on the bag is because the bag is sealed and it is sterile. What we will do is open the silver bag. There's a provided tab, and you just one tear. Very simple. Remove the bag. The nice thing about this system is that the bag contains the needle already so that you don't have to attach anything. That can all be discarded. Here's the bag with the needle attached, and now we're ready for the baby to be delivered. In this bag are the last few things that you need. We have povoiodine swabs, 2 alcohol swabs to clean the cord. We have an umbilical cord clamp, and then we have 4x4s, and we have an extra needle in case there needs to be a secondary puncture of the umbilical cord. If there doesn't need to be, this can be discarded. Now, baby's delivered. We're going to come, clamp the cord, and then with scissors, you are going to cut and the baby goes away. Now what we're going to do is focus solely on the placenta and the umbilical cord prior to delivering the placenta. Being that you're all set up, it's going to be very simple. Open povoiodine, clean the cord in the area of puncture, take 2 alcohol swabs, 1 down, 1 up. Take your bag with the needle that is already attached. Very important, bevel is to go up, facing up. It extracts the blood better. What you're going to do is hold the cord, insert into the umbilical vein. You'll see blood return. Then the most important step, 2 steps right now, this is the key to cord blood collection. Number 1, you want the blood bag below the level of the umbilical cord so it drains by gravity. Number 2 is we want to collect as much cord blood in this bag as possible. If that means taking an extra minute or 2, take the extra minute or 2. The placenta still has not delivered, so you have the time, and that way we gain enough fluid down into the bag. Remember, if we don't get enough blood in this bag, then we don't have enough stem cells to make a successful transplant. Just in case, there is a second needle provided. Most cases, this is never needed. However, if a second needle is ever needed, this can then be used as a second puncture into the cord, and the other end just goes right into the edge of the bag. Okay? Finally, after the blood is extracted and you've got no more draining blood, you're going to remove the needle. What we do then is we either cut the needle off and tie, or we just leave the needle on capped and tie. We prefer that if you cut off the needle, you will end up with a blood bag that is filled as far as it can be, and then cut the needle off and do a triple knot. Okay? We don't want any of the blood to leak during transport and then lose precious cells. So we're going to do a triple knot, 1, 2, 3, and your bag is ready to go. The last thing that you have to do is take that cord blood label. This bag must be labeled by HIPAA rules. And you're going to peel the label that will already be labeled, place it on the bag, and you're ready to go. In the box, we have provided one last piece of labeled information. It is an insulated bag. The insulated bag is already pre-labeled, ready to use. It just opens. What we do is take the mother's blood in the 2 purple top tubes, place it in the bag, in the silver lining bag. We take the blood bag that has its label placed on it and is tied into the bag. It is then peeled, sealed, placed in the original provided box with that information record. Close the box. It is then handed to either the mother or the father, and at the end of them being delivering, they call the 800 number, and there will be a person from a medical courier in their room within the next 24 hours.